Hello, everyone, and welcome to another episode of Talking Public Health, a Shelby County Health Department podcast. I'm Amaya Gray, Marketing Coordinator for the Shelby County Health Department.
And I'm Reginald Bernard, Manager of Health and Wellness for the Shelby County Health Department. And Amaya, today we have a show like no other. Today we are talking about the importance of public health outreach, bringing services directly into neighborhoods and connecting people with the information and resources they need to maximize their health.
Joining us today are Terrico Johnson and Yolanda Woods. Both are Shelby County Health Department managers whose work includes planning and coordinating outreach events in the community. Thank you both for being here.
Let's start out by telling our listeners a little bit about yourselves. Please introduce yourself, Ms. Yolanda Woods.
Hello, everyone. I'm Yolanda Woods. I am the Contract and Compliance Manager for Ryan White. I also work on the task force that creates, or rather we do the community care fairs.
And please tell the listeners about yourself as well, Terrico.
Yes. Hi, everyone. My name is Terrico Johnson, and I'm pretty much the logistic coordinator for the Shelby County Health Department. This includes community cares and other outreach events.
Outstanding. Well, we want to thank both of you all for joining us today. Community outreach means meeting people where they are, at churches, community centers, schools, neighborhood events, to make health care easier to access.
With that in mind, could you both tell us a little bit about the health department's community care fairs and how they help remove barriers like transportation, lack of awareness, or uncertainty about available services?
Well, one of the things about our community care fairs is we try to be in areas where we have the services are not easily accessible. So we're trying to provide those services to the individuals in the community. That's why we bring out as many of our programs as we can. Oftentimes, people are not even aware of the things that the health department or the programs that we offer. So we try to go into areas and provide services that they may not even be aware that we have. And then we're also really highly trying to provide immunization. You know, back to school is a busy time. And we're trying to make it easy on the parents who may work and are not able to make it to the clinic, to the health department to get their child's vaccination. So when we have these community care fairs, we also provide immunizations to them as well.
And I guess one of the things we also try to make sure we provide is in locations that's centralized. So a lot of our community members have trouble with transportation, cars, and things of that nature. So we try to put the events places where our community can walk if they have to get to them. And so it's really accessible from the community. You can see it off the road. We try to not, put it in areas like community centers or churches that the community know about, so they feel comfortable coming to those.
Well, that's amazing, Terrico, because this is one of the questions that I'm always faced with, is how does the health department choose the locations and venues for these community care fairs?
As I said, so it is a lot to do with the health disparities. We target certain zip codes. Zip codes, as Yolanda said, that really have a lot of needs. So we try to find those zip codes. And once we find those zip codes, then we go and try to find locations in those zip codes that, like I said, easily accessible, really the community know, too. Because one of the things that we see, the more the community feel comfortable with a place, the easier for them to come to it. So we try to find, like, okay, a community center, our church that's well known or whatever. And that's how we kind of do it. And like you said, and we also have to work with the churches or the community center when they're free, because we need them to be able to allow us to come. So a Saturday that may usually work for us may not work for the churches, may not work for the community center. So we try to partner with everybody to get a good date. And it's also, good for the community, but also good for the churches and good for us as the Shelby County Health Department.
And could you give us a little bit of examples or some of the examples of the churches or maybe the community centers that you all have been to in the past?
Yes. So like this past year, so in May we did one at St. John's Missionary Baptist Church in Douglas.
Oh, yeah.
And so one of the things, it wasn't the biggest church, but it was in a great location. It was off Chelsea, so if you was just walking or driving, you can see it. And also, we did it outside and indoors. So immunization was inside, but everything else was outside. So the community, if you was going to the corner store right across, you can just say, hey, what they're doing. And a lot of times, folks just come up and say, hey, what are you guys doing? Then we'll explain to them, and then they come in and they learn a lot of services about the health department they didn't actually know before. So that's why we want to make sure you can always see us. And so, because we also, we market and do all that, but a lot of times, best thing is sight. Oh, I'm coming over there. That's how we kind of plan where we're going.
Okay.
How important are partnerships when it comes to making these events possible?
So Terrico has just told you all the reasons why we go into the communities and we go to the community center and the churches. The partnerships help us be strategic about our planning, and then they also help us reach the community. The community often feels safe, as you know, with their churches, where especially the African American community and the Hispanic community, they're very, very connected to their churches. And when we go to a church, they feel safe. They feel safe about coming to that location. And the community center is where a lot of the children go after school. This is where they spend their time. So the parents feel safe about coming there and allowing their children to come there as well. So forming partnerships is one of the best things that the health department can do, because we cannot be everywhere.
Right.
But if we formed a partnership, this partnership helps us also provide those services.
Do you feel like the community welcomes the health department into those areas? Because, you know, a lot of people say, oh, they're here to do this, or we're usually closing down a restaurant or doing something like that, doing some kind of testing. How do you feel the community accepts us into those areas?
I would honestly tell you, every time we go to a community, we're going to get at least one, maybe two families, maybe wherever the church or the community center say, hey, thank you guys for coming. It's still, when you go to these communities that we're going to, they're often forgotten. So when you're there, and you're there providing services, and you're right, Reggie, they're so used to folks coming trying to take from them, right? I need you for numbers. No, we're coming to give you what we have. And we always get appreciated. I mean, it's always someone saying, hey, thank you guys for coming. If it's a mom who can get her kids vaccination in May, so she don't have to worry about that in July and August when school, you know what I mean? So it's always going to be someone's going to come to us and say, hey, thank you guys for coming. And that's everyone we have did. Someone has always, the community seemed very appreciative.
Yes, the community is always appreciative when we're there. We get a lot of feedback from them, because the community will let you know if they are not comfortable with you being there, or that you're really there to do something for them. And as Terrico said, oftentimes we're there trying to tell them what they need. This is what you need. We're going to give you what you need. But when we do our community care fairs, it's about providing services and allowing them to choose what they want to take advantage of.
Right.
So having mothers who may have come to get car seats. We sign up people for WIC when we're in the community. And yes, we do some testing. We don't do testing all the time, but testing is important as well.
Can you all tell us a little bit more about the health disparities in Shelby County and how the health department's outreach efforts address those disparities?
I think that's one of the biggest things for doing this, because there's so many health disparities, and so many communities in Shelby County deal with health disparities. Some deal with more than others, but we have so many that's lacking. Like in the health index, we have a 0 to 5 is the score. We may have between 10 and 15 of our zip codes that score 5, which means they are like in need of so many different services. And so we try to make sure we in those communities, letting them know where we are. Now, we are in other communities as well, but we really target to make sure those communities getting the service they do, because when we go there, we hear, I didn't know you guys did this. I didn't know you do this. And one of the things that we have target to bring with them is not just what we do at the health department. We're trying to break down silos. So we're bringing other agencies who may do diabetes checks and things that we don't do, so we can give you all different types of services, so you can go and know more about what your health is than just what we do at the health department. Because we are public health, but we do want to make sure that we partner with, whether it's Regional 1, our Baptist, our UT Health Science, something just making sure folks understand that this is a community event and not just a Shelby County Health Department event.
That's great. Now, Terrico, you talked about this earlier, so I'm going to pose the question to Ms. Yolanda. The summer is especially a busy time for the Shelby County Health Department as far as the outreach program is concerned. So, Yolanda, please tell us more about how the Shelby County Health Department helps to meet parents' needs in the crunch as they get ready to go back to school.
So as you know, oftentimes our parents in the marginalized areas, they are very busy. Some of them may work 2 and 3 jobs. And so it's difficult for them to come to the building itself between 8 and 4:30. So on every second and fourth Saturday, the health department is open. We provide immunizations. We are there so that you can get birth certificates. And then on the first Monday of every month, the clinic is open late as well.
So you mean to tell me we don't have to wait until school start and deal with lines or anything?
Absolutely not. one of the things that we really want the parents to understand is that if your child is in need of a school-age vaccination, you can come to the health department as soon as school gets out and get that vaccination. Come to any of the community care events because we often provide immunizations as well. So we're trying to reduce that stress on the parent of trying to get their child vaccinated to get in school, because when they go to school and they're not vaccinated, what do? Your child can't come to school. They have to get these vaccinations. We're trying to help them avoid the long lines. It happens, but we're trying to do everything that we can to take some of that stress off of that parent who has to work these several jobs, who can't get to the health department unless it's a Saturday. And so that's why we're open on the 2nd and 4th. And then even on a Monday, if they can make it on Monday, we're open late on Mondays to provide those same services. So we're trying to trying to eliminate that crunch feel that they feel like, oh my God, it's time, I got to hurry up and do this. We're trying to ease that burden.
And it seems as though this is a good look for the Shelby County Health Department to be open on those extra hours and that weekend, because as our topic is today is pretty much stepping out of bounds to look at how we can do services outside of the four walls. And so this gives us an opportunity to do services outside of the normal business hours to help those parents. So Terrico, tell me, what do you think about us stepping out of bounds to bring more services into our communities?
I think it's an excellent idea. I mean, not just because we're public health, but in this field that we're doing, when you're doing work in the community, you have to be for the community. So which means you have to go to the community. It's the way this works is you're in the community, you're for the people, and they see you. And I think, like Yolanda said, even with just the community cares and back to school crunch. So we have parents who come who had to, head back to school event trying to get book bags and things in that nature, and they're afraid if we step out of line for immunization, I'm not going to get my kids book bags. So we try to partner with agency churches and say, like, hey, we want to make sure while our moms and dads in the line with the kids to get immunization, that they still gonna get their book bag, and that makes the parents feel well because they are nervous. That like, what do I do? We want to alleviate their burden. That's being in the community, understand what the community need. That's us partnering with agencies who hosting back to school affairs, letting them know, hey, you want us to provide immunization. We need to make sure the mom and dad also get these school book bags and these school supplies because they need this. And so, luckily for us, our partners always do like, hey, we're not gonna let any child leave without a book bag. So go ahead and make sure you get your shots, then come over there next. Vice versa. Sometimes we have churches bring them to the parents who they so nervous. So we just want to make sure, and that's what us being in the community, partnering with places in the community that thinks like we do, that, hey, it is about the people and it is about the community. So I'm definitely, I think being in the community really serves us well because so many folks, like, not just to thank you, they just didn't know what else we do. It's not just the immunization because we bring other parts, we bring opioids, we bring other prevention programs, and it gets folks to understand, oh, the health department has that as well. So we definitely, being in the community is great.
And you brought up another good point, too. While they're in the health department, they can also get free books that are furnished by Porter Leith. And these books are used for kids so that they can read and do everything that they need to do while they're waiting to get their immunizations and things like that.
Absolutely.
It's all about the knowledge, bringing knowledge to our community, bringing knowledge to our children, too, so that we can increase awareness and have a reading rainbow.
And the health department has to be the leader.
Absolutely.
We have to be the leader. We have to lead. We have to be the organization that's leading to provide the services and looking out for the communities. If we don't do it, who will? It has to be us in that leadership role. We've got to be the people leading with it, and that's why we form partnerships, because we can't do it alone. It just can't. It can't work without forming partnerships and forming those partnerships, as Terrico said, with those organizations who think like us, who are concerned about the members of their community. That's why we do it.
Yeah. So speaking of like the services, what departmental services from the health department can people really look forward to at these outreach events?
Oh my goodness. So as Terrico said, sometimes we have opioid, we have immunizations, we have HIV testing, we have the Syndemic program that provides free HIV test kits, home test kits. We have Chant, who provides the car seats. WIC is not there, but you can still sign up for WIC if that's what you need. Where else do we go?
Ryan White.
Sparks. Oh my God, I forgot Ryan. The Ryan White program, the program that I work for. the Ryan White program as well. Sparks is there.
Health promotions.
Health promotions. That's Reginald. Sometimes Vector has been there, and Vector is a department that a lot of people don't really know that they're a part of the health department. So we've had occasions where we've had some of our programs there, and they're like, "Oh, I didn't know you did that." So it's also a way for the community to get to know what the health department, services that we provide, because we work there, so we think everybody knows what we do,
Right.
and we often find that people really don't know all of the things or services or programs that we provide. It's a great place.
I think Ms. Woods is in my head because that was the question that I was going to ask Terrico was what are some of the services people are surprised to learn that the health department offer?
Of course, I'm with Vector is the number one, because in Shelby County, so much miscommunication between the city of Memphis and the county of who does what when it comes to like animal control and things of that nature. So, and a lot of what our senior citizens is really because they call 211 and they get in the runaround. And so being able to be at an event and find like, oh, okay, so I need to call the Shelby County Health Department to get someone in vector control. It helps them because they really struggle. Like, I'm in a city, but no one from the city would do it, and they don't usually be told, hey, check with the Shelby County Health Department, because like Yolanda said, a lot of folks don't know what the Shelby County Health Department does. And so I think that's one of the big things, just letting them know things like that. The opioid prevention, because of the opioid numbers in Shelby County, it's getting folks to understand like opioid doesn't have a face. It's not a race. It is an issue that's affecting everyone. And so seeing these events like, oh, so this is what's going on in my community. Yes, one of the things we have like 38106 is a community that's getting ravaged by opioid deaths and overdoses. So we want to let folks know like, hey, this is in all zip codes. It's not a face you see on TV. It is all of our faces. And so things like that, by having these events, community members start like, okay, so this is something I need to look out for. Yeah, so that's why I think it's so important for us to be out here, because folks are learning things about different programs we had that they probably wouldn't know if we weren't out in the community.
And then we have vending machines. And especially one of our clinics, the Hickory Hill Clinic, has a vending machine, and you can go get Narcan, fentanyl test strips. So we provide those things. They're free. You don't have to put any money in there. It doesn't require a coin, doesn't require anything. You just push the button for what you want, and you get it. And I think that that's so important, because a lot of times individuals who may be abusing substance, they have people who are with them. And if they have this, then it may save a life. We're not just out there like Terrico said. Opioid overdoses is everywhere. It's not one zip code. It's not one community. It's affecting us all. And if we really think about it, one of us has probably even known somebody or heard about someone who's died from an overdose. So it affects us all.
So, Ms. Woods, why is it important for us as the health department, as employees of the health department, to be outside of the four walls of 814 or wherever we are located within Shelby County?
Public health, Reginald, says public. It's in the words. The public is outside of those four walls. It's the community. That is the role, and that is the whole mission of the health department, we're there for the public. If we're working in the four walls, who are we working for? We're working for ourselves. We're just looking at each other. We're just doing things for the employees. But it's about being in the community and reaching them and letting them know that we have a role and we have a place, and we're here to provide services to help in any way that we can. We want to perform the partnerships that we form. We do that because we want to partner with people who think the same way and understand that public health is about being in the community, not in these four walls. The services are in the four walls now, but we bring those services out of those four walls just so that you can understand that we can pivot and move and do what we need to do to provide the things that our community needs.
And Terrico, I've seen you at these community care fairs, and sometimes it's hot, sometimes it's cold. You're moving chairs, you're moving tables. But if someone in the community stopped you and said, "Why did you do this?" what would your answer be?
For them, for the community, right? Because this is what we're doing it for. Like, it's not just a job for me. It is a passion to make sure that we're serving in the community, giving the community the opportunity to get what the resources they need. As we see every day, we work at 814, you work at somewhere else. if you look online, they gonna think 814. This is what I need to go to the health department. But what if you don't have transportation? We got other clinics, but so often you think it's just here, and you're like, well, I'm in Hickory Hill. You may not know we have a clinic in Hickory Hill. So being in community and saying, hey, if you're in Hickory Hill, you know we got this here too. Oh, I didn't know. I thought I had to come to 814 and get my WIC. No, if you out here in Orange Mountain, you can go to Cawthorn. So I think every time we out, the opportunity for us to share information and get folks a helping hand is the reason I want to do it. So I like to do it just for the community. And the feeling that we're doing something for others is greater than just doing just work for me. So I really just do it for the community.
So one last question for both of you. What have been some of your most memorable experiences working at the community care fairs and our outreach events?
I'll defer and let Terrico answer that first.
Ooh, I see so many. Let me see. I would definitely say seeing so many of our families come out and feel heard, feel validated, and feel love. Because, so many times when you go through storms like so many of our parents do, and if you a mom with 5 or 6 kids, you always feel like everyone's judging you. But if you can come and see the service and see the smiling faces and feel like you're being treated well, it just makes you feel better. So that's what the thing. I done seen so many, like I said, so many folks come up to me and like, hey, thank y'all for coming. Like they don't have to do that. Right. And we also hear it's like places say, hey, can you come to my church? Can you come to this? And that only happens if they think you're doing a good job. Mm-hmm. Like that they felt when they was there, they felt validated, they felt respected and appreciated. And so it's say, hey, can you do this at our church? Can you do this in my community? Hey, what about this? And I think that's a great thing because we hear this all the time.
Mm-hmm. Yeah, I'm going to have to say the same thing. It's when we're there and one of the community members comes up and says, thank you for doing this. Mm-hmm. We really appreciate you coming and doing this. And it makes you think about what we take for granted, those of us who have transportation where we don't worry about how we're going to get somewhere. As Terrico said, a lot of times they think they have to come to 814 Jefferson, but we have satellite clinics, we have satellite offices. You don't have to come to 814 to get your birth certificate or get immunizations. You can go to our Shelby Crossing clinic that's at 1826 Sycamore View. Mm-hmm. You can go to Hickory Hill. You can go to Cawthorn. Do we still have our location in Millington?
Yes.
Millington, we have a location in
Tuesdays
Millington.
and Thursdays.
Tuesdays and Thursdays in Millington. Mm-hmm. So oftentimes they think that they have to go to this one main building, but we want them to know that we're in the community and there are other options for them. But the most memorable thing is when one of those community members or when a parent comes up and says, I really appreciate this. I didn't know how I was going to get this done. I work a lot, and this really helped me out. Mm-hmm. And it makes you feel good. I feel good on the inside because I'm one of these people. I'm a people person. I like people. Mm-hmm. And when I do something and it helps somebody, that's really a good feeling. And I think that the community care events that we do, and even when we partner with other organizations and we just go to their events, we're there to help the community. It's about helping the community. And I can't say anymore. Most memorable, though, is when we was at that 500-degree heat at the...
Which one?
Raleigh.
Yes. I remember that.
So many people, but so many people came out. It didn't matter. So many people in the community came to take advantage of the services that we were providing that day. Right. So it doesn't matter whether, I heard Reginald ask Terrico, whether it's cold, whether it's hot. We're there, and we want to make sure that we do what we can for the community, and they see that. They see that.
All right. Well, I've known you two for years now, and I've seen. Oh, you don't? Well, get to know me. and for all of the years that I've known you, I have seen the work that you've done. I have seen you go out in the heat. I've seen you go out in the cold. I've seen you offer the services to individuals in need in these different communities. And some things, sometimes we forget to say the little things. to the individuals that are helping us. And I want to say it today is to thank both of you all. Thank you for the work that you do. Thank you for the hard work and dedication that you have to your jobs. And I also want to thank you all for coming here to the show today with me and Amaya to discuss. And we heard the passion in your voices as you talked about the outreach that you all do within the community and why it's so important. And we want to thank you for the services that you offer to our communities, and most of all, our communities that are in need. So continue to do the good work that you do. There is a reward for you somewhere, even if it's not on earth. It's somewhere, because we need good people like you joining us. We need people like you doing the service for us within the Shelby County Health Department and our community. Thank you.
Thank y'all for having us.
Yes, thank you. Thank you for tuning in to another episode of Talking Public Health. Be sure to join us for more episodes as we continue exploring the people, programs, and stories that shape public health here in Shelby County. Until next time, take care and stay healthy.